Here to talk about guiding clients through postpartum depression. I have a couple of trainings with PESI that I would be thrilled if you would register for, and hopefully in the next couple of minutes I can help you understand why it's so important that we as clinicians and even as support people to new parents follow through and learn as much as we can about this period in someone's life. There's a QR code in the corner, and there's a link at the bottom that if you use to register, you can explore some of our training options and some of the material that you can learn through PESI. I'm going to start by just sharing a couple of little pointers about postpartum depression, sort of lesser known pieces of information that we think it's really important as specializing professionals for clinicians to know. First, I'll say that many of us don't think about across the scope of our practices, who's our population and do we see new parents? Because we often think about, the couple or the individual who comes in and said, yeah, I have a couple of kids. I have a 4-year-old, I have a 3-year-old, I have a 2-year-old. We don't necessarily think about them as postpartum. And while medically they're not, when we trace back the onset of some of their mood or anxiety issues, oftentimes we can trace it back to when they became parents or the journey to parenthood. And so regardless of what the focus of your practice is, really we want to advocate for giving our clients all an opportunity to share about what their transition to parenthood was like so that we can find out if some of the themes that can come up around perinatal mood and anxiety disorders do come up for them at that juncture in their lives and how it can be impactful later. Untreated, full-blown mood disorders that emerge in the perinatal period can have lifelong impact on the person who is experiencing the perinatal mood or anxiety disorder, as well as the rest of the family system. So I want to just repeat what I said a couple of minutes ago for those who are just tuning in. My name is Hilary Waller. I'm a faculty member for PESI, and I'm here to talk about guiding clients through postpartum depression. My training through PESI, which you can access through the QR code or the link at the bottom, is available for you to take a look at. PESI has a lot of really wonderful trainings and opportunities to learn about perinatal mood and anxiety disorders. And here I'm just going to give an opportunity to learn a few of the things that specializing professionals know that general practicing clinicians in other specialties, or even people who just support new parents in different ways might not learn in their educational programs, or even in some of their other non-specializing in this field CEs. So first, I want to point out that regardless of what kind of practice you maintain, regardless of what age clients you work with, if you're working with an adult population, whether you work with birthing people or not, perinatal mood and anxiety disorders can touch any and every family member, any and every family system. Perinatal mood and anxiety disorders are full-blown, diagnostically relevant, diagnosable through the DSM, major depressive disorders, generalized anxiety disorder, obsessive compulsive disorder, et cetera. Full-blown mood disorders that emerge during the perinatal period, so the period of pregnancy through the first postpartum year. Clinically and in the training that I provide, we talk about how those issues can actually onset or manifest later than that first year postpartum and what we're looking for in the first couple of years postpartum. But all of that to say, when we see someone who's experiencing symptoms of a mood disorder, depression, anxiety, those symptoms, when untreated, can manifest into lifelong mood and anxiety disorders, can have an impact on the self-esteem of the mother, the birthing person, can have an impact on the development of the family system, the development of the child, et cetera. And so it's really, really important that not only do we intervene as early as possible, but that even if you're a clinician who's seeing patients who maybe have older children, who have kids that are 3 or 4, who have kids that are even in their teens, we'd be asking the questions, hey, what was it like for you when you became a parent? Did you experience symptoms of anxiety and depression at that time? How did your self-image change during that time? How did your relationships change during that time? So regardless of who our population is, we want to look at the period of becoming a parent, the period of kind of making family planning decisions as a really important part of one's development. And so having some specialized training in the area of perinatal mood or anxiety disorders, postpartum depression, anxiety, et cetera, can be really helpful in the way that we understand how someone's symptoms came to be and how someone's worldview has come to be. But speaking about that sort of early, truly perinatal in the medical sense client, so we're talking again about pregnancy and clients who are within the first year of postpartum. Something that a lot of clinicians aren't aware of is that when we think about postpartum depression, lots of people think about specifically cisgender birthing women who are very, very sad and possibly disconnected from their babies. And that couldn't be further from the truth, actually. We see postpartum depression, we see postpartum anxiety, we see pregnancy-related anxiety and depression. So again, that catch-all term, perinatal anxiety and depression. We see that in all birthing parents. We see it in non-birthing parents. We see it emerge in parents who've adopted children. We see it emerge across the gender spectrum, across race, around the world. And so there is no parent who is immune to the types of mood disorders that we see emerge in the perinatal period. So again, for this reason, we really advocate that for clinicians who are seeing clients who are pregnant or expecting to have a baby enter the family system, or who are within the first postpartum year, so up until that child is 1 year old, or 1 year post perinatal loss, we want to be screening for symptoms of perinatal mood and anxiety disorders. So really important to know that statistically, 1 in 5, we say 1 in 5 women, 1 in 5 people will experience symptoms of a perinatal mood or anxiety disorder. So I'll ask you to think about the people that you interact with in your practice. Do you see that 1 in 5 of these sort of eligible people who've had a baby within the last year, that 1 in 5 of them are meeting criteria for a major mood or anxiety disorder during that time period? And if you're not, ask yourself why. And so I'll talk about some of those reasons just for a moment here. Ask yourself whether you're screening. Do you know how to screen for perinatal mood or anxiety disorders? Do you know what screening tools to use? Are you familiar with the EPDS, which is a screening tool that's widely available and used in a lot of hospital settings to identify symptoms of postpartum depression and also postpartum anxiety? If you are screening, and you're not seeing the 1 in 5 come forth with, yeah, I have symptoms of depression or anxiety, then I want to ask you to think about, how are you screening? What are your screening practices? Are you following best practices? Do you know what questions to ask to augment the screening? When a new parent is handed a piece of paper with a 10-question questionnaire, and they have perhaps a crying baby in this arm or a child in a carrier over here, a toddler running around at their appointment, it can be hard to self-assess. Questions can be difficult to answer. It can be hard to think about how you've been feeling over the past 2 weeks. So it's really important that even when we are screening, we know what questions to ask to help gain more information than perhaps the screening itself shows. Furthermore, we oftentimes will see that screenings that are completed come out to paint a picture of the person who's taken the screening that matches what they want us to see. Because the most vulnerable place for a new parent to be is in that space of questioning, am I doing a good job? Am I a good parent to my baby? Am I being perceived as a good parent? Does my community perceive me as a good parent? And if not, what kinds of fears come up for that person? So for example, in some communities, particularly in BIPOC communities, we see a lot of fear about my baby will be taken away from me, because we see that happens in many communities. And so parents work very, 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 very hard and tirelessly to make sure that they're perceived as good parents, which is wonderful. The problem with that is that if they worry about disclosing their symptoms and they don't tell us, I'm trying really hard to be a good parent, but I cry all the time, or I have scary intrusive thoughts about my baby, or sometimes I have thoughts of suicide, or I'm having obsessive compulsive tendencies. I'm scared about the way that I'm feeling. If parents are afraid to disclose that to professionals, then we can't help them. And so their symptoms linger, their symptoms fester, their symptoms can worsen. And what we see as a result is a high rate of suicide in the perinatal period. And I believe, and many specialists in the field believe, that we're in a really good position to help prevent suicide and to mitigate risk of the severity of these symptoms, because if we can get new parents to talk with us about their symptoms, to disclose their symptoms, if we can bust some of the stigma, if we know what questions to ask, if we know how to open and broach these conversations, then we will create safer spaces for parents to disclose how they're feeling to us. And so when parents disclose how they're feeling to us, the fantastic news is that all perinatal mood and anxiety disorders are very, very treatable. And what we see is that parents who enter treatment for perinatal mood or anxiety disorders, the outcome is so beautiful. My favorite part of my job as a therapist who works and specializes in this field is that I get to see families have an opportunity to sort of build themselves from the ground up, rebuild themselves after perhaps the trauma of having a perinatal mood or anxiety disorder. And we see the journey from feeling really symptomatic and perhaps very, very impaired during the onset of parenthood to this beautiful emergence of someone who's self-confident, who finds their agency again, who bonds with their child, who feels positive about their journey, who can experience a tremendous amount of post-traumatic growth. So it's such a beautiful journey to witness and to support. And it's important that we help parents know that that's the outcome for well-treated perinatal mood or anxiety disorders, and that those outcomes are achievable. Something really important to note, and then I'll ask for some questions if there are any, is that when we're looking for a diagnosis of perinatal depression or perinatal anxiety, the symptoms can present slightly differently from what we're used to. So while people with perinatal depression, for example, will report tearfulness, sadness, feelings of worthlessness, guilt, self-blame, we do see a lot of similarity there. What we often see is a lot of high-functioning people. And so I challenge you to sort of look around your world, look around your practice, and when you see a new mom, for example, in the line at Target, and she's cooing at her baby, and this is a beautiful sight to see, and I myself might sort of look and think like, oh, what a sweet thing I'm witnessing here, right? Remember, she's working hard to make sure that everyone around her perceives her as a good mother. She's working hard to be a good mother to this baby whom she loves, even if she feels out of touch with feelings of love. She's working hard to make sure that I perceive her as having a sweet moment with her baby. And I never can tell from just looking at her. And what we see in the waiting rooms of our offices are mothers who coo at their babies, who cradle their babies, who feed their babies, parents who are attentive and loving. And one would never know that they were suffering with thoughts of suicide, suffering with plans for suicide, suffering with severe symptoms that severely impair their well-being, their self-esteem, their lives, their ability to connect with their partners, their ability to care for their other children, go to work, etc. Because what we see on the surface very often in patients with postpartum depression and anxiety are people who present beautifully, both because they put the effort into presenting beautifully and because very often they're highly, most of the time, highly motivated to care for their babies. And so something really, really important in learning how to notice postpartum depression and consider it as a possible explanation for symptoms and diagnosis around what's going on with your patient is really understanding that what we see on the surface never tells the whole story. And even when we ask the question, how are you doing? How is it going? Here's your screening. We might not be getting the whole story. So it's incredibly, unbelievably important to seek out specialized training so that you know what questions to ask. Again, I'll remind you that if you'd like to receive that training through PESI and with me, there's a link in the QR code in the corner. There's also a link that'll pop up on your screen so that you can take a look at the trainings that I offer and the other trainings in the perinatal period that are offered by PESI. If there are any questions, I'm more than happy to take them. And if not, I hope you'll find me on PESI's website. And then I'll have an opportunity to interact with you that way. Thoughts about the medication that was just FDA approved for postpartum depression. Thank you so much for asking that question. It's a really, really great one. I am incredibly excited that that postpartum depression is receiving a lot of attention by some of the best researchers in the field. The team that has been developing this drug is outstanding. I think it will make an enormous difference for women who have severe postpartum depression, and specifically for postpartum depression that was an earlier onset. The challenge, however, and I've seen some of the news articles that I've read and some of the media that I've seen, the challenge is that I don't think that we're clarifying that this drug really shouldn't be used without therapy or other supportive measures. While it's effective in treating severe symptoms of postpartum depression, and I think that it's an absolutely amazing and and field shifting discovery. On the other hand, there's so much psychosocial challenge in the perinatal period. It's also really, really important that we as therapists ensure that parents are having those symptoms addressed also. And a drug doesn't necessarily mitigate all risk for the development of the psychosocial symptoms. So understanding in your perinatal clients the interplay of the biopsycho and social is really, really important, regardless of the medication that your patient may be taking. And so this is an amazing tool for the right clients, and I'm so excited to see where it goes and how it's best used. And I also really want to strongly advocate that it's not an answer, it's not a cure-all. And I will forever advocate for all new parents to have the support of a mental health professional if they need it or even if they want it. It's a stressful transition. And so making sure that we provide the support that's needed is critical, no matter how fabulous the drugs are on the market to help augment recovery. Any other questions? Okay. Thank you so much for those who tuned in and for those who are going to be watching on YouTube. I'm so honored to be able to present some of this information. I'd love to interact with you in my upcoming live training. I'd love to have you reach out to me if you see the recording. Again, you can check out my trainings by using the QR code in the corner or by looking at the link in the bottom. And I'm looking forward to hopefully hearing from some of you in the future. Thank you so much for the work that you're doing on behalf of perinatal clients and birthing people. It's incredibly important, and I hope that together we can kind of move the needle on how parents are feeling supported in our culture. So thank you so much.